Hi, morning, afternoon, and evening, wherever you are. And if you are a returning subscriber or a viewer of this channel, thank you so much. This is the Kosh TV on YouTube. Okay, the long-awaited content or vlog on the pre-operative management of the diabetic patient. It's here. Actually, this is my second recording. The previous one, can't find it. It's kind of gone missing. So I decided to wake up earlier than usual to do this one, and I hope I do justice to it. Before I go ahead, I would like to give a big shout out to everyone supporting this channel in every diverse way. The Kente of Experts Club International members, kudos. I'm so grateful for your support in your diverse way. Yeah, I may not know what you do, but I'm sure everyone is doing so much to support this channel. And all those professors out there, again, I'm saying thank you. Thank you so much. Okay. I did in my last vlog, if you actually saw it, I did say that I was on the mend. Honestly, I really do not want to be using this medium, especially this channel, to be talking about health issues, like personal health issues and stuff like that, because anyway, things will change. Things are evolving. Actually, as I speak with you now, I'm so excited about the prospect of talking to someone I've so admired. Let me just leave it there. Okay. It so happens that I would have to undergo a surgery. Yeah, a surgery. For the first time in my life. It's an orthopedic surgery, like musculoskeletal, so that's to my shoulder. Let's see how things go. A date has not been set yet, but if it does, I'll let you know about it. I'll let you know what's happening, but it's not going to be the norm. Trust me. Anyone out there who is tired of hearing about these things, don't worry, it's not going to be the norm, because I really do not like it, but it got to a point that I had to actually speak up, and that's how you people have come to actually realize what's going on. There's so much that goes on. I'm a health professional myself. So much goes on in the health system. Some we can control, some we have no control over. So we just have to try and do the best within our power to make sure that our clients, our patients that come into our care are well catered for. All right? Enough about the chit-chat and talking about myself. So again, you're welcome to Kosh TV, and I am Janet. This channel is aimed at improving the well-being of the individual, the family, and then the community as a whole. And it's backed by a group of knowledgeable experts, okay? Very knowledgeable in their various field of profession. I'm talking about health professionals and anyone who contributes to the well-being or the development of the community. And we are looking for people. We do not want it big, but if you think you are able to do that, contribute to the community, you're so welcome. I do not want to scare anyone, but it's likely to be a bit challenging, so please think about it carefully. Okay. the pre-diabetic management of the pre-operative management of the diabetic patient. Okay, what's the main aim of managing, because managing a diabetic patient who is undergoing an operation? The main aim is to control their blood sugar level. We aim at glycemic control and possibly detect and then correct any diseases, any derangement in their cardiac function, the renal function, and other diseases, so that this does not impede their recovery process. Okay, because the uncontrolled level of blood sugar or blood glucose in the system, one, we know, can impede a good wound healing, a good outcome, patients getting back on their feet early, because if these delays, then it means the patient's ability to get back to their day-to-day activities is likely to be affected. All right. Okay, I will be linking some reading links to the comment, will attach to the video, so please just to read, make your informed judgment, because every institution or every health facility should have their diabetic protocol when it comes to managing them preoperatively, perioperatively, and postoperatively. So though there are standard guidelines, I'm speaking from the United Kingdom, like let's say the NICE guideline, which is the National Institute of Clinical Excellence, and other ones like the intensive care protocols, a standard intensive care protocol, and there are a few out there. The institution, that health institutions, do also have their protocol, because that's what they have used and it has worked for them, usually through researches. So anytime you find yourself changing institutions, health facilities for the purpose of work, make sure you familiarize yourself with their protocols in place. All right. Okay. So as I said, I've got a few points there, so maybe looking that way. The main aim is to optimize the glycemic control, okay, and to minimize complication that may come with probably the heart being affected, the kidneys being affected, and some diseases that may not have been discovered. Okay, and to actually aim this, it takes the multidisciplinary team. If I talk about multidisciplinary team, those who are not familiar with the term or the word, we're talking about all health professionals. The surgical. Think about the surgical team. Think about the doctors on the ward. Think about the diabetic nurse. Sometimes we tend to forget these people, but honestly, when it comes to situations like that, they play a very vital role. And when it comes to dietitians, when it comes to physios, okay, so all these people form the multidisciplinary team to make sure that the diabetic patient undergoing surgery, sorry about that, I've got something about to go under surgery, is well prepared, has been well assessed, and everything is in place for a successful outcome. Usually assessment of these of any patient, anyone to go under operation, to have surgery, sometimes, honestly, where I'm speaking from, it starts from the community with your GP, okay? Through your visits to your local doctor with a complaint, they are likely to come out with a diagnosis, okay? If they are not able to, and they think you need further treatment, or if there's a need of further investigation, you will be sent to the hospital, okay, to see a specialist, in terms like that. Anyone who is in the United Kingdom knows what I'm talking about. So the preparation process under normal circumstances should take that path, okay, should take that pathway. It starts from the community. You've seen your GP, investigations has been done, possibly diagnosis has been made, and then you are referred to a specialist who is going to take care of you through to your treatment, okay? And yes, after the treatment, you're back to your local doctor, okay? Right. So the aim of the outcome, I've already mentioned that, to make sure your cardiac system is working okay, your renal system is also fine, and they would have to review your medications, because a lot goes on. If you know that the type 1 diabetic patient is insulin dependent, usually insulin dependent. Type 2, they go on the hypoglycemic agent, but they can later develop into a type 1 that way, and then later end up being on insulin, okay? So all these situations has to be taken into consideration, because drugs will have to be medication will have to be properly managed in such a way that it does not affect your system when you are fasting, or over that period of time from your prep for surgery, through the surgery, and then till you become alert enough to take medications. All right. Okay. So now here we go to my health professional colleagues, especially nurses. What's our role here? So here, nurses, what's our role? Everybody undergo physical examination. We look at their history, physical exam in terms of the observations, blood, and all that. Usually this is done outpatient. Nurses, do you understand where I'm coming from? The patient might have, under normal circumstances, come previously to the assessment department, because we don't usually keep them for them to have all these investigations before the day of the operation. Sometimes they have to come weeks earlier to have their bloods done, ECGs done, all those things for every normal patient before the date is given for them to come in for the surgery. Okay, for the diabetic patient, after going through all these, okay, for the diabetic patient, I would also mention that let's make sure we do not forget their ECGs, because of the electoral imbalances. Sometimes it has play on the cardiac functions, if you know what I mean, and it helps with with springing into I wouldn't say it helps into starting treatment promptly if there is the need for it. Okay, so the ECGs on the day of the surgery should always be remembered. All right. Sometimes these things we tend to forget them, and we are human. You can't be a superhuman all the time. But let's remember the ECGs pre-operatively. Okay. Okay. So you would have received the patient's history, everything. I mean, I sound like some. Anyway, you would have received the patient's history, how the blood glucose has been working over a period of time, and so when they come to you on the ward, as you prepare them for the surgery, your assessment, you're doing your observations, that's the temperature, blood pressure, pulse, and then ECGs on the day of the surgery, and then this is you comparing, finding out that okay, the blood glucose that you take, you're trying to find out if it's actually, pardon me, within the same reading as what they may have come with from home or from their community. Okay, so it's basically we are assessing their metabolic control, how control the metabolic system is. That's so their current HB A1C should be taken into consideration, and it's you, the nurse's responsibility to make sure that these things are recorded on the patient's system, their folder, their file. Make sure these things are there, because hey, you don't want to end up, just show that you know what you're doing. All right, show that you know what you're doing. Check these things and make sure they are there. Check and make sure that when they came to the pre-assessment department, they had the necessary investigations done. All right. If there is the need for anyone to be notified because something has been omitted, find out the reason why and just document as appropriate. Okay. What else? Oh, urine test. It's important as well. And more so, it's important. Not just in the diabetic patient, the female patient undergoing surgery must have their urine test done, because you're going to check for pregnancy. All right. So in this case, when you're having let me not forget this bit. The male undergoing urology procedure also needs their urine dip checked. Okay, their urine checked. But in terms of the diabetic patient, you have to check to make sure that the ketones and the protein are within an acceptable range, because renal impairment has to be ruled out. Okay, that's when it comes to the diabetic patient. Okay, so trying to see if there's anything I have omitted. Yeah. Now let's talk about medications. The MDT team would have spoken. They would have spoken or relayed information onto the team. Everything is documented. So, but the standard procedure, according to the NICE guideline, is that the evening before the patient goes into surgery, those on insulin injections must have their insulin must have their insulin reduced to 80%. Okay, they must have their insulin reduced to 80%. The evening, that's depending on what time they have, if it's with their meals or before the day of the surgery. So the patient is going to fast. From that evening till the following day of the surgery, and you have to aim to get these patients, the diabetic patient, into theater early. They should be the first on the list because they have a different metabolic system. Okay, different metabolic system. So the patient who isn't a diabetic. So the earlier you get them into surgery and out, you can continue monitoring the blood sugar level and then aiming for a successful discharge home. All right. Okay. And those on metformin, the hypoglycemic agent, metformin, it has to be discontinued 48 hours before surgery, especially when there is going to be intravenous contrast administered. All right. There are reasons why. Please find time, make time, and then read around the drug metformin. Find out indications and contraindications. Okay, it's quite an interesting. I did find out a few things some years ago. I'm still waiting to see. Anyway, yeah. So you find out, please. Okay. So those on metformin need their medication stop 48 hours before the day of before because of especially when they're going to have an intravenous contrast administered, if it involves that. And when it comes to insulin, some literature saying they should be halved, but what I have read and from experience quite some time ago though, is 80%. Okay, 80%. I did say this much in my previous video that I lost. That let's say the patient is 10 unit or is on 10 units of Novomix, whichever glycogen, and they are to go for surgery the following day. So you give 8 units instead of the 10 the evening before their surgery. All right. Okay. And for type 1 diabetics, there is most likely the plan of them being on intravenous infusion. Okay, they are likely, and this also depends on the protocol of the facility that you're working in, and how stable the patient is, patient's condition, and how stable they are preoperatively. They are likely to be on intravenous infusion before surgery because they need to be within a certain range. We are aiming for a blood glucose level of 6 to 10 millimoles. Some literature have actually stretched it a bit to about 12 millimoles, okay, before surgery. What else? What patient possible must... Yeah, I've already mentioned that. Patient must be the first on the list to minimize any complications and you having to run out there getting glucose and all that, trying to get the patient into a stable condition. So the communication between the operating team and then let's say wherever the patient is coming from to the theater must be clear enough. And you, the nurse taking care of this patient, if there is anything you are unclear of, ask. Speak from previous experience. You, the nurse, should be able to communicate with the operating team, okay? Whoever may have assessed this patient. I'm talking about the surgeon, the anesthetist or anesthesiologist, the diabetic nurse specialist. So you communicate with these people, so you do know what's is expected of you. Okay, so when you do in this way, it's kind of makes your work much easier. So you have a clear mind, or clearly stated that, okay, this is what is expected of you, and this is what you are doing to achieve that. All right. And the thing is that after you've seen this or dealt with situations like one or two more times, you do know. However, every patient is different. Okay, every patient is different. Mind you, surgeries of late, people do not keep in hospital for so long. Sometimes within 24 hours, patients are discharged home. Okay, or 48 hours, they are discharged home. This is due to the plan that has been, how effective the plan that has been put in place has been. All right, so do well to communicate and then deal with the situations within your jurisdiction, and always seek for clarification if you are not sure. All right, okay. I hope this helps. I hope it helps. If there is anything I haven't touched on, please feel free to state that in the comment section. Do well to share. Please share, comments, and then like. I will be coming again with the post-operative. That one is a bit more involving. It's going to be. I was hoping that I wasn't going to take so much time, but it's taking a little bit of time. But that one is going to be a bit more. So let's see. I may do it in two parts. So I'm going to end this way, and I say, let's remember, you the nurse out there, you the doctor out there, every health professional or any professional who deals with the well-being of individuals and the community, remember, our well-being, the client's well-being, depends upon ourselves and the community. So let's try to make a positive influence or impact wherever we are, and always remember to stay healthy. Till I come your way again, I say bye bye.